want to talk to you about dating someone with borderline personality disorder. And I want to talk about the difference between borderline personality disorder and narcissism, and how to recognize the characteristic traits of someone with borderline. I feel that the term narcissist gets sort of thrown around very, it's overused, let's put it that way. And I think, first of all, it's very important not to self-diagnose your significant other, especially freshly after a breakup. It's very easy to just throw these terms around, but they're very serious mental illnesses, and it's important to understand them and recognize the traits, but not to self-diagnose. So if you feel that your loved one may have strong traits of either borderline or narcissism, it's important to encourage them to go get a psychological evaluation, because awareness is the catalyst to change. And you can have a healthy relationship with these people as long as you're both willing to ride the turbulent waves, as long as you're both willing to do the work, and as long as you both have an understanding of what's really happening. Because there's a lot of push-pull. There's a lot of resistance to love, is what it boils down to. There's a lot of fear. So let's examine the basic traits that someone with borderline personality has. It can be difficult to discern the difference between someone with borderline and someone with narcissism, but there are some unique traits, and I'll discuss the similarities and differences in a few minutes. But someone with borderline has a very deep fear of abandonment. This person has they've likely experienced traumatic events in childhood. So they've likely been either abused or neglected, and possibly both in childhood. They have a very poor self-image. They don't like who they are. And again, that's probably taught from childhood. Sad. They may have weight issues, so they may be either underweight, overweight, or their weight may fluctuate. They likely have a tendency to overexpress anger, displace blame, lack personal accountability and responsibility, blame shift, have bursts of anger. They have low emotional intelligence and lack the ability to express their emotions in constructive ways. They may come across extremely loving one moment and extremely hateful the next. Excuse me. So they have very impulsive behaviors. They may be very adventurous. That's a good quality, right? But that adventurous side may lead to very risk-taking behaviors. They may have depression and anxiety. You might find they sleep at strange hours. They have a history of poor relationships, unstable relationships. And again, they may blame all their exes because they lack personal responsibility. So again, they have these fits of rage, and this is the push-pull dynamic. So similar to a narcissist, where a narcissist will love bomb you and bait you in, draw you in with tidbits of affection and appreciation and attention, and then boom, bash you down. They will provoke anger. Well, a borderline will do the same thing, and you'll experience a very similar trauma bond, which is those ups and downs, fluctuation of push, pull, give you just enough love, and then push you away. And that's because for a borderline, love is not a familiar feeling. They didn't have that in childhood. So when they poke you and provoke you, and you have reactive abuse, the term reactive abuse means you fight back because you've been poked, you've been provoked. That's a comfortable feeling to them. That's familiar. So they like that abuse. They don't really like it, but that's what's familiar to them. So that's their comfort zone. They don't like compliments. Someone with borderline personality is not comfortable with compliments. That pushes them out of their comfort zone. That's unfamiliar to them. They don't like themselves. Remember this. They're uncomfortable with their self-image. So if you tell them you like their new haircut, or you tell them that they look gorgeous, that's going to freak them out. They don't want to hear that. If you tell them they're a piece of crap, they're not any good, and you're, done with them, oh, they are thrilled. That's their comfort zone. So it's very sad, it's very confusing. If you're the one being pushed away and they're not accepting your love, you can't say anything right, you can't do anything right, it feels impossible. So the first step is encouraging them to get the diagnosis so that you don't feel crazy and you can both work together toward that person accepting your love, accepting the fact that you do want to give love to them. You do want them to feel how great they are as a person because you see it in them. They just don't see it in them. It's unfamiliar to them. So that's sort of borderline in a nutshell. And I hope that you now have a better understanding of the similarities and differences between borderline and narcissism, and can navigate your relationships a little bit more clearly. We also need to explore the world of CPTSD, complex post-traumatic stress syndrome, which looks a lot like borderline and a lot like narcissism, but it's a whole different ball of wax. And I'll discuss that on a different day. So thank you so much for being here. Thank you to everyone who has subscribed. We are growing as a channel. And if you haven't yet, please hit that subscribe button. Comment, tell me about your experiences in toxic relationships or healthy relationships. And I appreciate the fact that you're here and you're wanting to learn more about them. You are